Hello there and welcome to a brand new episode of Hello Kuwait. My name is Tariq Al-Aryan and we're coming to you from the Ministry of Information Studios right here in downtown Kuwait. And I hope everyone out there is having a great evening wherever you may be watching tonight's episode. I'm joined tonight by my colleague Rita. Good evening, Rita.
Good evening, Tariq. How are you doing?
I'm fine. What about yourself?
Great. Thank you so much for asking. And good evening, dear viewers. Of course, we have a lot of great content for you this evening. A lot of reports and, of course, a guest that will be joining us. So let's view this first report and we'll be right back. Dear viewers, we have been joined by our guest for this evening, Dr. Jibin Thomas, Internal Medicine. Good evening and welcome to Hello Kuwait, Doctor.
Hi, good evening.
It's our pleasure to have you with us this evening, and we're going to be talking about a very important subject since I think it has become cool to smoke or especially vape lately, especially with the younger generation, which I think is very unfortunate.
Yeah.
So in the beginning, can you explain to us the main differences between smoking traditional cigarettes and vapes? What's the difference between these two?
Yeah, as we know that smoking started hundreds of years back, and people believed for a certain duration that smoking was very healthy.
Right.
Because you inhale in smoke and they believed that it killed the bacteria and it will not create any diseases. So traditional smoking involves tobacco, which is a plant leaf, which is dried and which is rolled into a paper.
Yes.
And which needs to be lighted by a fire, and it burns in the mechanism of combustion.
Yes.
And this tobacco releases nicotine. Nicotine, as we know, is a chemical which is very harmful for the body.
Yes.
And which when reaches the brain, the smoker gets the pleasure or whatever he needs. So this is comparatively very different from the newer techniques which has evolved over hundreds of years into vape.
Yes.
Vaping is a device, it's a device which is portable and it can be carried in your pockets, at your office and anywhere.
Anywhere, literally.
Yeah, anywhere, literally, yeah. And it has a battery, a lithium ion battery, an atomizer, liquid, a liquid which contains nicotine.
Yes.
So when the button is pressed, the battery pushes the heating and the liquid becomes vapor. So this vapor is generally nicotine, and this nicotine can be taken inside into our lungs.
Yes.
And this is how the vaping mechanism works. So traditionally these both are very different. But as we know, this traditional smoking, it has a lot of chemicals other than nicotine, more than 7,000 chemicals,
Yes.
of which we in the medical field, we already know that 80 of them are direct cancer causing agents.
That's right.
But still people tend to smoke. But vape in return also has other chemicals which cause disastrous changes in our body. So this is
Yes.
basically the changes between traditional smoking and the vape.
Definitely, they're
Yeah.
so different, and
It is.
unfortunately, a lot of people are using vaping to quit cigarettes.
Right,
which
right.
I don't think is the best idea, but we'll get into that in
Yeah.
a bit. So, what are the most common short-term and long-term side effects of smoking on our bodies?
Yeah, smoking, as you know, it is burning, and on this combustion, it has smoke.
Yeah.
So smoke, when it is inhaled, it can start the changes right from your lips. It will change the color of your teeth.
Right.
It will change the texture of the mucosa of your oral cavity. As you take the smoke into your body, it will create changes in your esophagus, your respiratory tract, your lungs, your lung tissue changes,
Yes.
and also short-term effects. It can increase your heart rate,
Right.
and which leads to increase in blood pressure. Also, some people can get confused. They can have short-term memory loss. All these things happen as a short-term effect. But coming to long-term effects, the body can have very disastrous changes, which can end up even being to the death of a person.
Wow.
Yeah, this is mainly cancer causing. People believe that cancer only comes in the lungs when they smoke or they use vape. But it starts from the oral cavity, which is our mouth. The oral cavity, the tongue, the
Yes.
esophagus, the lungs, the pancreas, the intestine, the stomach. Literally everywhere where the smoke goes and hits,
Yes.
it can have a disastrous effect. And you know that the lungs is the breathing machine for the humans.
Of course, and that's how you stay alive.
Yeah.
You
this-
kind of need your lungs.
And this lung can have a disastrous change. We'll call it the chronic obstructive pulmonary disease, which is a very chronic disease for the lung, which is not reversible. And also people who have asthma can get triggered when they smoke. People can have cardiovascular issues like leading to heart attacks, which is a long-term effect. People
Yes.
can have atherosclerosis, we call as the deposition of plaques in the arteries.
Right.
They can also have peripheral arterial disease, that is numbness in the leg and reduced blood supply to the leg. All these are the long-term complications.
So there's a lot of serious
There is
long-term
lot,
complications that don't just involve
Yeah.
our lungs.
Exactly.
Definitely.
Exactly, yeah.
What about vaping? That's what I want to know about, because
Yeah.
I think people see that it smells good and tastes good,
Yeah.
so automatically they
Yeah.
think that the short-term and long-term effects are not as bad as cigarettes.
Exactly. The people think that vaping is very safe because it releases less smoke. Some vapes have no smoke at all,
Yes,
and some vapes have flavors in it.
exactly.
So this, when the vape, you inhale the vapors, even though there is less smoke, there is no tar or carbon monoxide in the vape. But you should know that there are many other chemicals called as diacetyl, tetrahydrocannabinol, and all these are very dangerous and cancer causing agents.
Wow.
And this can also have very disastrous changes because this is real nicotine which is in the vapor form, which will be absorbed very fast into your body. It will cross your blood-brain barrier, which is like a barrier in your brain. It will reach your brain cells very fast, and it travels very fast into your body.
Right.
So speaking of the changes of the effects in smoking and vaping, there is no much changes, but the only difference is smoke is less in vape.
Yes.
But the disastrous effect is equal in both
Right.
vape and smoke.
Definitely.
Yeah.
It's always not the best idea to smoke, no
Right.
matter what we're smoking. If we're vaping, traditional
Yeah.
cigarettes, of
Yeah.
course, the side effects are there. So, are there any misconceptions we can say about smoking, vaping that you would like to address or talk about?
Yeah. I started my talk with telling that smoking evolved like hundreds of years back.
Yes.
In those times, people believed that if you inhale smoke, it can kill bacteria, it can kill viruses, and you will not get any disease for your oral cavity or the respiratory tract. This is what people believed for hundreds of years. And it took like long years for us to understand that it has so very bad disastrous effects. So now coming to vape, vape also similarly, it just evolved like 10 or 15 years back. We are
Yes.
studying still on the long-term effects of vape, but you know the misconception with vape is that people think vape is really safe.
That's right.
They think that the flavored vapes are very safe, it is harmless, and it can be used by anyone. And they think that because there is no smoke, it is not dangerous at all.
Right.
But what you need to know that it leads to addiction, which nicotine is a very highly addictive substance.
Definitely.
Yeah, and people think that because there is no smoke, there is less nicotine. But it is exactly the opposite.
It doesn't work like that.
Yeah, it doesn't work like that. Every vape has a set amount of nicotine in it. You can
Yes.
increase the nicotine, you can reduce the nicotine. It's controlled by how much amount of liquid is there in the cartridge.
Right.
So it's not safe at all, and the misconceptions regarding smoking, the traditional cigarette and the vape is too much. Not
Yes.
to ask, it is too much.
There's so much going on.
Yeah,
of
so much
course.
going on, yeah.
Definitely, and I think there's a lot of misconceptions to do with that. As you mentioned, I think the biggest
Yeah.
one is that people think that there isn't nicotine in it or
Right.
there's less nicotine,
Right.
while honestly having a vape is way more accessible than smoking because a lot of places you cannot smoke indoors. So people are vaping all day long, right?
Exactly,
So
that's
it's
right.
as soon as they open their eyes till they
Right,
fall
they start
asleep
vaping,
again,
yes.
which is very unfortunate. So how does smoking affect the respiratory system, and how does that compare to the effects of vaping also?
Yeah. You know, smoking, the smoke goes directly into your respiratory tract. And there are many organs even before it reaches the lungs. It starts with, I said, your mouth, your oral cavity, your esophagus, then it leads to the trachea, the respiratory tract. And along this respiratory tract, there are many things called as cilia,
Yes.
Cilia are things which help to throw out the mucus and the phlegm in your respiratory tract.
Right.
And once you start smoking, this cilia are endothelial things which get damaged. And literally when you smoke each time, the mucus increases in your respiratory tract, and which leads to, you know, congestion in your lungs, which can lead to infections, and, you know, it becomes disastrous.
Yes.
So when you talk about vape, vape is real nicotine. This, even though there is no smoke, this nicotine is directly injected into your system.
Yes.
It pushes your heart rate very high, the blood pressure bounces, you will get a palpitation, and many people get confused after starting to take vape. And you know, this respiratory tract and your heart is connected.
Yes.
Your blood goes to the heart, the deoxygenated blood get oxygenated, then it pushes onto your lungs. So when you vape or smoke, the nicotine which reaches the lungs has a direct effect on your blood, which reaches all your organs.
Exactly.
All your organs will start to show the signs and symptoms of nicotine toxicity. The first one to show will be your brain, because your brain captures this nicotine a lot, because there are so-called as receptors, which we call nicotine acetyl receptors. These receptors are found in your brain. The nicotine gets attached to these receptors and releases a thing called as dopamine.
Yes.
This dopamine helps you to get energetic, get pleasure and all. So as much as nicotine you smoke in, people start getting too much of dopamine. So this is what ends up in, we call as addiction,
Right.
which is very difficult to take away once a person becomes addictive.
Of course.
Yes.
Definitely. Some people seek treatment
Right.
for addiction for
Yeah.
years and years. So it's not as easy
Yeah.
as a lot may think. And what about our cardiovascular system?
Yeah.
Is it any better when it comes to vaping, or are we still dealing with the same issues smoking has on it?
Yeah, there is no much difference to say the truth, but vaping has more of bad effects onto the cardiovascular system, because as I said before, vape has a cartridge,
Right.
and in this cartridge you can fill it with the nicotine liquid. This, any dose can be kept in this cartridge, not like traditional cigarettes. Traditional cigarettes have a set amount of nicotine in it.
Exactly.
You cannot increase or decrease. But there are different types of cigarettes, like low, light cigarettes, cigarettes with no tar, etc. But vaping is more dangerous because of the nicotine level involved in it.
Yes.
People can start very low, they can end up very high. Because of this very high nicotine, it, as I said before, it increases your heart rate. That is short-term effect, and the long-term effect, this nicotine can end up in myocardial infarction, which is heart attack.
Yes.
It leads to, you know, accumulation of plaques in the
Yeah.
arteries, which is lipids like cholesterol. It gets deposited in your arteries. It can lead to, you know, heart blocks, and also it can lead to many other problems like pain on the legs, leading to peripheral arterial disease. Your legs will become really numb and dead because there is no blood circulation.
Yes.
For a long time smoker, they will have symptoms while walking, like pain on the legs, because their blood circulation is very less.
Wow.
Yeah, because their arteries get clogged with plaques because of this high nicotine. And so comparatively there is no much difference, but vaping, I think it's more dangerous because of the high amount of nicotine involved in the vape.
Definitely.
Yeah.
And I think it's also so dangerous because we don't understand how serious it is, you
Right.
know.
Yeah.
A lot of people are using it as if they're using anything normal,
Exactly.
which it's definitely not. So can you describe the effects of smoking and vaping on our oral health and our dental health? Because you
Yeah.
mentioned yellowing of the teeth,
Right.
darkening of the lips.
Yes.
Does it have any more symptoms we can say?
Yeah. As I said before, the smoke starts from your oral cavity. It
Yes.
can damage your teeth. Yellowing of the teeth. Your teeth is protected by something called as enamel. It protects your teeth from any dangerous chemicals or liquids. Once you start smoking, the enamel will get eroded, so that your teeth is potential to any infection or any kind of chemicals. It will erode the teeth, leading to your tongue. Your tongue can have whitening of the tongue, and there can also be precancerous lesions, which many
Right.
people don't get checked up, and they end up being under cancer. So these precancerous lesions are white kind of lesions we call as leukoplakia, which appears on your gums, on your lips, on your tongue, which can be seen when you visit a dental doctor, a dentist. It can be easily identified. And once you stop smoking, you can go back. There's a reversal from pre-cancer. But if you avoid it and you continue smoking and you do other things which damages your mucosal cavity, it will end up being in cancer.
Right.
So the tongue will have the change, the gums will have the change, coming to your esophagus it will have change. I told before, the cilia will get damaged in your respiratory tract, your trachea will have changes, your tissues will change, your lung will also change. Talking about vaping, there are new diseases which come under vaping. We call as EVALI, which is E-vapor associated lung injury.
Right.
This was seen more during the COVID-19 period.
Definitely.
And there were extensive changes in the lungs because of the smoking from the vape, and which doctors even couldn't identify with COVID-19, because COVID-19 lung issues were also more during that time. So there was a study which was telling that people who used vape ended up having lung issues during COVID-19.
Definitely.
Yeah, so as I said, from the lips till your lung, there are a lot of changes, multiple changes. Also, there can be something called as halitosis, we call, which is bad breath.
Yes.
This bad breath happens with smoking and vaping. And also there can be dry mouth. The saliva in your mouth can get dry. And these are similar changes can happen everywhere in your body,
I think it's definitely countless side effects and symptoms. And of course, we're going to discuss all the other aspects, Dr. Jibin. But to your viewers, we're going to be going to a break and we'll be right back. And we are back from this break, and of course we are still continuing our conversation with Dr. Jibin Thomas, the internal medicine doctor. So we were talking about the effects of vaping and smoking, but how does it affect our immune system?
Yeah, as we all know, the immune system protects us from infections, any kind of diseases, everything. Our body fights with something called as antibodies.
Yes.
So once someone starts smoking, there can be decreased immunity in his body. Also, the immunity whatever he had will decrease, which can lead to autoimmune diseases. Autoimmune diseases are a condition in which your body fights against your own body's cells.
Right.
So these autoimmune diseases can get triggered once a person starts smoking or vaping. Also, it will increase the susceptibility to diseases, all kind of infections like tuberculosis, like emphysema, chronic obstructive pulmonary disease, asthma, bronchitis, bronchiolitis obliterans. All these are caused when the immune system is damaged.
Yes.
Bronchiolitis obliterans is a lung condition which can happen with vaping, which we call in a funny name called as popcorn lung.
Yes, I've heard about that.
Yes, this is because the nicotine and the smoke reaches your alveoli, which are the smallest respiratory functioning things in your lungs, and it becomes like a popcorn. And that's why we call it as a bronchiolitis obliterans. And this disease is a very chronic disease and very difficult to manage in people who continue smoking.
Yes.
So as your immune system get damaged, you are susceptible to get all the infections around. Be it COVID-19, be it any kind of H1N1, any kind of influenza virus. So your immune system is very important. Once you start smoking, there will be extensive inflammation in your oral cavity, in your respiratory tract, in your lung, which would lead to all these kind of diseases.
Of course, and I think with everything I'm hearing right now, you would think that people would try their best to smoke, but as we to not smoke, sorry, but as we mentioned that nicotine is very addictive, highly addictive actually. What makes it that addictive that people are willing to deal with all these side effects?
Yeah, when someone starts smoking, as I said before, this nicotine is rapidly absorbed into your body. It reaches your brain very fast, and your brain in turn releases a reward. This reward we call as dopamine. I spoke it to you before.
Yes.
This dopamine gives you extensive pleasure and also energy, etc. And once a person starts smoking, they would want more of dopamine. This is where the addiction starts.
Yes.
Because they need more of pleasure, more of energy, so they continue smoking for a very long time.
That's right.
But when we talk about traditional cigarettes and vape, traditional cigarettes, as I spoke before, have a set amount of nicotine.
Yes.
But vape, the amount of nicotine can be from very low to very high. So this is potentially very dangerous.
Of course.
It can lead to more of the addiction. And also, as we spoke before, there is no smoke involved in vape. People tend to vape more, even in office, even at home.
Yes.
They are not scared of any fire alarms.
Exactly.
You know, it's easily portable. You can take it anywhere, use it anywhere, and they tend to use it more often.
Of course.
But if it's a traditional cigarette, you need to go to a specific area, you need to light it, you know.
Exactly.
Yeah, and also people get more addicted to traditional smoking because there is a sensory component to this traditional smoking. People like to catch the cigarette. People like the smell of cigarette.
Yes.
People like the idea of lighting it. And you know, this is a sensory component.
Right.
They get a pleasure doing all these things. So this is also another part of addiction. So all these things combined together make smoking and vaping very addictive.
Definitely makes a lot of sense because it seems like an entire experience that they are able to have. What I really want to know is, what advice would you give to someone that's actually trying to quit smoking or vaping?
Actually, quitting smoking is very challenging. We think it is very easy, but for someone who is a chain smoker or a chronic smoker or using vape for a very long time, it is very difficult to stop it. But you need to have a right strategy. And you need to have a correct mindset, and you need to put a plan. If you do it this way, sure, you can stop smoking.
Yes.
But then there are certain things which you need to keep in mind.
Can you explain those to us?
Yeah, you need to set a date. You need to write in your calendar, I would stop smoking on so and so date. And I would completely quit it by so and so date.
Nice.
You need to take away all the triggering factors. Some people have triggers for smoking. Like some people have a lot of stress and tension in office.
Yes.
So they tend to go out all the time and try to smoke.
Right.
Or try to use the vape. Some people have tension back at home. They tend to use smoke or vape all the time.
Yes.
So there are triggers. And also a person needs to write down their strategies, how they will stop having these triggers. Once you have the strategies, you can easily work out to quit smoking. But if you need help at any time, you need to ask.
Right.
You need to seek support. There are a lot of support mechanisms around. A lot of people who can help you. There is a community out there who can help you to stop vape, to stop smoke.
Perfect.
But also you need to know there are other things like prescription medications which can be given to reduce the cravings, the addictions, and also there are nicotine replacement therapies.
Amazing.
Which comes in the form of nicotine gums, nicotine patches. So there are a lot of things if you want to quit smoking, but you need to ask, seek, and look.
Perfect. So it's a long battle, but it's doable, we can say.
Right, exactly.
Definitely. So do you think that there are any new treatments or even therapies on the horizon that you find promising to help people to actually quit smoking and vaping?
Yeah, there are lot of technologies and digital advancements in this modern world, which starts with cognitive behavioral therapy sessions are there, which a person can do online, like a counseling session or a training session, which will help them online to stop the cravings for having the smoke. And also the latest method of techniques involve virtual reality simulations, which is the latest in the field. People are given virtual reality simulations in which they are put into a world and they are exposed to triggers for smoking. And they are made to fight against these triggers so that when they come back to the real world, they can do the same thing. So this VR simulation method is one of the latest. And also another one I want to talk to you is about a transcranial stimulation technique, which involves stimulation of your brain using a magnetic thing to reduce the addiction and craving, because your brain has certain areas which gives you addiction and cravings. So once you stimulate it from outside using a neuromagnetic technique, you can actually reduce smoking. So these are one of the latest, few of the latest digital advanced methods to reduce the amount of smoke or vape.
That's really amazing. So
Yeah.
there are different options out there that
Yes.
we can try and
Right.
just really test out to see what works
Yeah.
best for us. I think that's really great news. So how can individuals, we can say, best protect themselves in a way or another from secondhand smoking, which is a very true issue, honestly.
This is actually one of the very dangerous things rather than active smoking.
Yes.
We call it as a passive smoking or a second-hand smoking, where the smoke is inhaled by a person who is not a smoker, either be it your colleague, be it your spouse, your husband smoking, or the wife is smoking. So the second-hand smoke goes to the other person and becomes very dangerous. This is equivalent to smoking.
Yes.
So to protect from this, you need to speak up to the person who is doing this next to you, be it your colleague, be it in your family, your relative. Tell them, please, this is creating second-hand smoke and I am inhaling this,
Yes.
and this is very dangerous for my respiratory tract. And it becomes very dangerous when a husband starts smoking and the wife is pregnant,
That's right.
because this smoke is being inhaled by the mother. The mother has a baby growing in her tummy, so this is very dangerous for the baby as well. So there are strategies which a person can do. One is they can wear a mask if they are at the office.
Yes.
And also other thing is they can stay away from the colleague or the person who is smoking. If you are in a closed room, you can open your ventilation.
Yes.
All the offices and rooms have windows, so you keep it
Definitely.
open, keep the air circulation active so that the smoke goes out. So these are very few things which you can do to prevent second-hand smoking, but there are a lot of other things as well
Of course.
which we can do by ourselves.
Well, Doctor, thank you so much for
Yeah.
all the medical information you gave us this evening on the side effects of smoking, of course, traditional cigarettes and vaping. And thank you for being here this evening.
Thank you.
Thank you. Dear viewers, we had with us Dr. Jabin Thomas, the internal medicine specialist. So up next, we have a report and we'll be right back. Dear viewers, with that, we have reached the end of our episode for this evening. I hope you enjoyed it as much as Tariq and I did.
It was a pleasure co-hosting with you this evening, Rita. And with that, we come to the end of tonight's program. Make sure to enjoy the rest of your viewing tonight and all throughout the week right here on KTV2, the family channel. Before we leave you, remember to always take care of yourselves and each other. And let's always remember to respect one another. Have a nice evening and good night for now.